Private members' business. Notice number 2, Medicare.
Call the member for Lawler.
Thank you, Deputy Speaker. I move the motion relating to Medicare in the terms in which it appears in the notice paper. Thank you, Speaker. It is an absolute pleasure to stand to make my first contribution to our new parliament and to make it about Medicare, to move a motion that celebrates that Labor, being returned to government, will act to strengthen Medicare. And we will do that, the same as we did in the last parliament. When we came to government in 2022, it had never been harder or more expensive to find a doctor. Bulk billing was in free fall after a decade of cuts and neglects to Medicare. That's why strengthening Medicare was a key focus of our election platform. And as a member of parliament who was here during the decade of cuts and neglect, let me tell you how important this is. I was here in the 2014 budget was put in by the previous government with its GP tax, a co-payment initiated by law would have been. I was here and worked with members of the public, members of my own community, to march in the streets of Melbourne to push back on that policy, to push back on that then Minister for Health, the member for Dixon, then Peter Dutton, and his plans. But they were not deterred when the public saw that off. They then built in, by regulation, to freeze the indexation for the Medicare repayments, which in effect led to doctor upon doctor, centre upon centre, to introduce a co-payment of their own to seek fair payment for the services of our GPs in our areas. The opposition now needs still to learn that lesson well, that if you want to talk about what's pivotal to 27 million Australians, our universal health care system is pivotal to the safety, to the health of the 27 million Australians. It is absolutely pivotal. Medicare, being able to see a GP without your credit card, without getting money from the bank, but the ability to walk in and see a GP, to have your preventative health measures cared for by a general practitioner in your own community, is fundamental to what Australians believe their healthcare system should provide. It is fundamental. Our universal health care is fundamental for most Australians as something that they want to see. They want to see to ensure that it stays as part of our health system. And of course, there's lots of reasons why, but the most important reason is that preventative health saves government dollars in the longer term, saves the amount we have to spend on hospitals, saves the amount we have to spend on chronic conditions. It means that Australians are walking around healthier if they've got a preventative health system in place for them. It means early detection of chronic diseases. We've run these arguments a million times, and now, in a second-term government, we get to deliver $8.5 billion for more bulk bill GP visits each year, hundreds of nursing scholarships and thousands more doctors. And I just want to make the point in my community, one of the things that the previous government did was they ripped us off the distribution priority area listings. And it had been a fundamental thing in my community where overseas doctors had come and done out-of-hours care in my community and gotten themselves their Australian licences in doing so. When this was ripped away, when my local GP clinics could no longer do that, not only did our hours of offering to see a GP shrink back to business hours, so we lost our longer hours, and in a community where people are getting home from work on public transports at 6 o'clock and leaving in the morning at 6 o'clock, those long hours are really, really important. Not only did those hours shrink back, but in my community, we lost 30% of our GPs. 30% in a 12-month period dropped. We've put the DPA back in our last term of government, and those numbers are lifting again. And we're really proud to be part of a community where international doctors are receiving their training and getting their qualifications. We're really proud of that in our community. Our community has seen some of those doctors put down deep, deep roots. Build new centres. Universal healthcare, that's what it's about, and those opposite need to acknowledge it.